Hello, I am Baymax, your personal healthcare companion. I was alerted to the need for medical attention when you said, "Ow."
A robotic nurse.
On a scale of 1 to 10, how would you rate your pain?
Physical or emotional?
I will scan you now. Scan complete. You have a slight epidermal abrasion on your forearm. I suggest an antibacterial spray.
Whoa. What's in the spray specifically?
The primary ingredient is bacitracin.
It's a bummer. I'm actually allergic to that.
You are not allergic to bacitracin. You do have a mild allergy to peanuts.
Not bad. You've done some serious coding on this thing, huh?
Uh-huh. Programmed him with over 10,000 medical procedures. This chip is what makes Baymax, Baymax.
Oh, wow. If only that was real. If only we could each have a Baymax in our home. Wouldn't that be awesome? Well, what if I tell you that it can be possible? Hello, my name is Farnaz Kanchi, and today I will introduce you to the world of IBM's Watson. So how did the 2011 world champion become so smart? What is it actually? It is a simulation of the human thought process in a computerized model. It's independent, automated IT system that does not require human intervention to solve problems. It eats through big data, which are volumes and volumes of data that is unsorted, and it uses complex sorting and analytical algorithms to make sense out of it. 80% of world's data at this point is unsorted. Watson makes sense out of it.
When Watson goes to work in a particular field, it learns the language, the jargon, and the mode of thought of that domain. Take the term cancer, for instance. There are many different types of cancer, and each type has different symptoms and treatments. However, those symptoms can also be associated with diseases other than cancer. Treatments can have side effects and affect people differently depending on many factors. Watson evaluates standard of care practices and thousands of pages of literature that capture the best science in the field. And from all of that, Watson identifies the therapies that offer the best choices for the doctor to consider in their treatment of the patient. With the guidance of human experts, Watson collects the knowledge required to have literacy in a particular domain, what's called a corpus of knowledge. Collecting a corpus starts with loading the relevant body of literature into Watson. Building the corpus also requires some human intervention to cull through the information and discard anything that is out of date, poorly regarded, or immaterial to the problem domain. We refer to this as curating the content. Next, the data is pre-processed by Watson, building indices and other metadata that make working with that content more efficient. This is known as ingestion. At this time, Watson may also create a knowledge graph to assist in answering more precise questions. Now that Watson has ingested the corpus, it needs to be trained by a human expert to learn how to interpret the information. To learn the best possible responses and acquire the ability to find patterns, Watson partners with experts who train it in using an approach called machine learning. An expert will upload training data into Watson in the form of question-answer pairs that serve as ground truth. This doesn't give Watson explicit answers for every question it will receive, but rather teaches it the linguistic patterns of meaning in the domain. Once Watson has been trained on QA pairs, it continues to learn through ongoing interaction. Interactions between users and Watson are periodically reviewed by experts and fed back into the system to help Watson better interpret information. Likewise, as new information is published, Watson is updated so that it's constantly adapting to shifts in knowledge and linguistic interpretation in any given field. Watson is now ready to respond to questions about highly complex situations and quickly provide a range of potential responses and recommendations that are backed by evidence. It's also prepared to identify new insights or patterns locked away in information.
So how does Watson Health improve the spectrum of care approaches? It assists with proactive interventions, preventive interventions, ongoing treatments of chronic conditions, and high-touch and multidisciplinary team care. It equips the expert with new insights to individuals and population health to help add confidence to their decision making and diagnosis. It provides them with an overall view of the patient's not only allergic conditions, medical history, but also their lifestyle, which assists in diagnosing and correcting the problems faster. The goal of Watson is to provide new ways for providers to connect with their patients. It improves diagnostic certainty and reduce mistakes. So what makes Watson so important in our life? And how is it really helping the medicine division? This is a data bank that can read 40 million documents in 15 seconds. IBM estimates that the medical data will double every 73 days until 2020. It is capable of using the data as a cross-reference tool for each patient's individual diagnosis, just like our friend Baymax, but with a larger-than-life knowledge base. So, if it comes to your health, would you choose Dr. Watson or IBM Watson? Thank you for watching my presentation. Please leave any comments or questions in the link below. Bye!